Hello and welcome everyone to this short workout that's going to help you build some pelvic stability and either prevent, manage, or possibly even cure pelvic girdle pain. Pelvic girdle pain is a general term that we use to describe pain that could be happening really anywhere around the pelvis. But there are a couple joints to keep in mind that can be particularly troublesome, especially in pregnancy and especially in late pregnancy. But this is possible for really anyone to experience. So the joints that we're going to be addressing today and the muscles around those joints that we're going to be working on strengthening and lengthening are the pubic symphysis or symphysis pubis, depending on who you talk to, in the front. And this joint in the front does have a little bit of mobility. Of course, in pregnancy, we have the hormone relaxin that allows the ligaments and tendons around the pelvis, particularly, but really all over the body, to become more relaxed, as its name implies. So some people will experience SPD, symphysis pubis dysfunction, which can be very, very painful. So I'm going to be talking about some tips and tricks, really even how to move around so that you minimize that. And then if we look at the back of the pelvis, of course, we have two joints on either side of the sacrum, and that's called the sacroiliac joints. We have the ilium on either side. And it's important to note that this sacrum, it moves forward and back, or in nutation and counter nutation. As well, any sort of instability or muscular imbalance in the body can create either a pinching on one side or a gaping on one side. So the pelvis can be shifted upwards on one side. It can be twisted. There's a lot of things that can happen that basically put your joints out of alignment slightly. So we'll be working on stabilizing through balancing exercises as well. So with that, we're gonna get started, and you don't really need anything, but you could use a blanket or some pillows. If you're pregnant and you find that you're uncomfortable lying on your back, you can begin this seated. Or you could lie down and put a few pillows underneath your back and head so that you're more on an incline and you're not flat on your back, although we won't be there for very long. The other thing that you might want to use here is a block, or if you have like a little pillow or a towel or something that you can put between the knees. One of my other favorite props to use is a small Pilates ball. So anything that you can use in between the thighs, not too large. I usually use the block on the skinniest level. That's going to be perfect. And if you don't have anything, you can just imagine squeezing and have a little air gap between your legs, but engage your inner thighs. So with that, let's go ahead and come down to lying on the back or seated. Now, when you transition, especially if you have any pelvic girdle pain, one of the best things to do is think of yourself as a mermaid. So you're gonna keep your knees together, and then you're gonna make sure that you just take a little bit more care in rotating around when you're coming onto your back, or things like getting out of the car, right? So you're gonna place a block between the thighs or whatever prop that you have. And this is really only to get the inner thighs to engage. So now we're gonna practice a little bit of pelvic floor engagement with the breath. Pelvic floor health is really crucial when it comes to dealing with any sort of pelvic instability. So the crash course of this is, as you inhale, the muscles are going to relax and lengthen. That means your abs, it means your pelvic floor. And then as you exhale, you're going to think about drawing your pelvic floor muscles in and up and wrapping your abs around the back and the front. So inhale, everything relaxes and lengthens. And then as you exhale, pulling the pelvic floor muscles in and up. Remember, you have anterior and posterior, so you can think about the front and the back, and the abs wrap around. Again, inhale and exhale. Now we're gonna add a little bit of that squeeze of the block. So you're gonna inhale and relax your inner thighs. Inner thighs are also known as adductors. And then as you exhale, you're going to squeeze the block or whatever prop that you have as you pull the pelvic floor muscles up and engage the abdominals. Nothing's really moving yet here. Inhale and relax everything. We're just focusing on the engagement. Exhale, engage inner thighs, pelvic floor, and abdominals. There are deep back muscles that are also involved here in your core stability. They're a little bit less obvious to feel, but you can think about them again as you do your next exhale and think about engaging everything, hugging in your midline. And now from here, I want you to just give that block, ball, whatever you have between the inner thighs, a little bit of a squeeze. And then you're going to inhale, and as you exhale, you're going to gently rock your low back, pressing into the ground. In Pilates, we call this an imprint, and then inhale and come back to neutral. So just gentle pelvic tilts, exhale, pressing the low back down. And inhale. Now I have a fair amount of pelvic instability in my pregnancy, so I will feel the SI joints get unstable. I'll feel usually at the very end of pregnancy pubic symphysis. As the baby moves down and forward, you may notice that you have possibly less back pain, but more pain in that pubic symphysis at the front of the pelvis. So it is caused by the movement of the baby in pregnancy, but again, you can have this kind of instability, and it can really be limiting for things like picking stuff up, doing yard work where you're grabbing things and dragging stuff around, picking up your kids, even doing weightlifting. I do a lot of dance and flexibility circus training, and so if you have instability, any of those exercises or any of those movements can become irritating. It's really a bummer. Fortunately, we just have a few things like this imprint, this pelvic floor engagement, this breathing, these breathing techniques. And they're very simple, they're very gentle exercises. They may be a little boring, especially for those of us that like more exciting exercise. However, they're super crucial and they don't take a lot of time. So if you pick a few of your favorite exercises and you do them a couple times a day, especially if you're late in pregnancy or you're going through a very unstable period, maybe you are experiencing a rehab from some sort of injury and you've got pelvic instability. Whatever it is, if you do a couple of these exercises a few times a day, and I just mean like a few minutes, it's gonna make all the difference in the world. So one more time, you're gonna exhale. And then what we're gonna do is I want you to squeeze your inner thighs, so your block, your towel, your ball, whatever you have, and then also press your pinky toes into the ground. I've really discovered in this pregnancy that this particular engagement is very, very stabilizing and relieving for my pelvis. So again, it's squeezing the inner thighs and then pressing the pinky toes down into the ground. So in other words, we're not allowing ourselves to roll into the big toe. Instead, we're keeping our weight even throughout the foot, but the inner thighs are very engaged. Weak inner thighs are very, very common and can really be a contributing factor to pelvic instability. So I have a little something underneath my head. I'm going to remove it now because we're going to go into a shoulder bridge. And we're just going to come up into a tiny shoulder bridge on an exhale. See if you can squeeze your lower glutes, and then inhale, lower that back down. And return your pelvis to neutral, allowing the pelvic floor and inner thighs to relax. Then we exhale, squeeze the inner thighs, squeeze the block, tuck the tailbone, come into imprint, and then just do a little tiny bridge. Now don't forget that you're pressing into your pinky toes as well. You can also pull your heels back in your bridge to engage the hamstrings, and inhale and lower down. And if you do that, and it's the first time you've done that in a while, you may get a hamstring cramp. It's okay. It's just your muscles learning how to work. So again, exhale, squeeze the block, pelvic floor engagement, imprint the low back, meaning your lower abs are working. Lift your hips, pull your heels back, press into your pinky toes, and then lower that back down. The next one, we're gonna go ahead come up and hold. So inhale at the bottom, and then you're going to exhale and squeeze the block, press the low back down, and lift your hips. We're just going to come into a little shoulder bridge again. This is not my highest shoulder bridge, just floating the hips a little bit off the ground. And then I'm going to tilt the pelvis back and forth and basically do that imprint in the air now. But I'm going to still think about squeezing the block. I'm still going to think about pressing the pinky toes into the ground. And I'm also going to think about pulling the heels back. But when I tuck, I'm really going to give a lot of attention to the lower glutes. This also helps with general posture. And if your general posture is misaligned, it's going to put excess pressure on your pelvis, maybe even your low back, your hips. You may end up with knee pain and foot issues and shoulder issues. Like, it'll go all over the body if your pelvis isn't properly aligned in your general posture. And a lot of people either shove their pelvis too far forward, or they have that kind of sassy bottom situation happening where there's excessive lumbar extension. So if you find a way to keep your pelvis neutral with muscular balance just in general, you're going to experience a lot less pain and instability. So from here, we're going to really tuck the tailbone and think about even pulling your ribs down. This is hard in pregnancy, but we could still do it. You just have to think a little harder about it. So you're going to exhale, pull the hip bones up towards the ribs, pull the ribs down towards the hips, and then we're just going to pulse the hips up. Now we're coming up as high as we can, and we're really trying to target the lower glutes, the hamstrings. So if you're feeling this in your low back, likely you are not tucking enough. And a lot of us will kind of do our shoulder bridge in a very low backy way. And that's because of tight muscles in the back and weak butt and tight hip flexors and weak abs. So it's not what you do, it's how you do it. And you always want to make sure that you really watch your form whenever you're doing an exercise, because the same exercise that's really good for you can be really irritating if you don't have great form. So pull your hips up towards your ribs. 3, 2, 1, and then lower that back down. We're going to take the block away for the moment, and you're going to heel toe your feet and your knees together. Now this one's really wild because you'll notice that you can't probably lift up as high. So I want you to push your heels down into the ground, squeeze your legs together as much as possible, press a little bit into your pinky toes, pull your heels back, tuck your tailbone, and then lift your hips up again. And I want you to just hold this bridge for a moment. Your knees are absolutely together. It demands a lot more of the inner thighs, and it demands that your hip flexors stretch a little bit more, which is why you might notice that you don't go up quite as high. And then from here, we can do little lowers and lifts. Inhale down, exhale up. Inhale down, and exhale up. Think about shooting the knees forward as you lift your hips up, because what a lot of us will do is we'll push backwards on our heels, like slide your shoulders back. That's not what you want to do. Pull your body forward. So as you pull your heels backwards towards your butt and you lift, you are correcting a quad dominance habit. And you're using your hamstrings more intelligently. And hamstrings are really super important for the pelvis because the hamstrings actually attach at the sitting bones, which is the very bottom of the back of the pelvis. 2 and 1. Now we're going to hold it up here, and we're going to go ahead and open the knees out to the sides. And as you do that, I want you to push your heels together, and then you'll close the butterfly wings, bringing your knees back together. And open back out, push the heels together. Really make sure that you're still doing that tailbone tuck here, long low back, and squeeze the knees back in. Knees out to the sides, press your heels together. And knees back in. And once more, knees out. Press the heels together and just hold it here. So this is a position that when I'm not pregnant, I'll actually flip around on my belly and do. Because what it's doing is it's helping you engage your back glutes and your side glutes. So, and your external rotators. All of your butts, many of your butts are engaging right now. And that really hugs the muscles into supporting the joints. So your sacroiliac joints are getting a nice little hug right now. 5, 4, 3, 2, and 1. Bring the knees back together. Squeeze the knees together. And then lower that back down. Nice. And then from here, we're going to go ahead and roll onto one side. So again, the best way to do that, especially if you're experiencing pelvic girdle pain, is make sure all your transitions, your knees are together. I'm going to grab my block here. I'm going to place my block wide between the knees. Now, it can be any width that you want. So if you're feeling a lot of pubic symphysis discomfort right there in the front, then you can make your block more narrow or skip the block and just have your knees together. So just depends on how you feel. Then from here, we're going to give that a good squeeze. And you're gonna lift your upper foot, still squeezing. So what I'm doing here is an internal rotation with the femur bone, and lower that back down and up and down. We'll do 15. So this is 13, 12, 11, 10, 9, 8, and while you're lying on your side, just make sure that your abs are engaged and your low back is long. Here's 6, really squeeze the block. 5, or squeeze your knees together, whatever version you're doing. Good. And 2. And 1. Nice. And then from here, you can remove the block, and we're going to squeeze the big toes together now and do some clamshells. So again, make sure your low back is long, squeeze the big toes together and up for 10, 9, 8. I'm not twisting in the hip. That's why I have my hand here, because it really helps to monitor that. 5, 4, 3, 2, 1, and then we're going to lift the feet for a high clamshell, flex the feet, push your heels together, and up for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. And then lower that down. You're going to abduct the legs. So you're just lifting and lowering the leg for 10, 9, 8, 7. Just working a little bit of that side booty. 5, 4, 3, 2, and 1. Now from here, you're going to place the foot either behind you and straighten out your lower leg, or I like this hip stretch. You could place the foot in front. So wherever it's comfortable, just need the leg out of the way, because we're going to be lifting the lower leg now. So you're going to pull the abdominals in, make sure your low back is nice and long. You're going to float that lower leg up. Again, small movements. Use your pelvic floor, because anything asymmetrical can cause more stress and strain in the pubic symphysis. And we'll do little pulses here for 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and circle. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch directions. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. Go ahead and release that now. Again, recommend that you keep your legs together just for the extra stability. And we're going to transition on over to the other side. So we'll start with the block. Move like a mermaid. And then from here, you're going to place that block between the knees and get as much rotation and range of motion that you can here. So I'm going to touch my toes together and then lift up as high as I can. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, here's 5, and 4, 3, 2, and 1. Nice. From here, you can remove the block, and then we're going to push the big toes together and do external rotation for 10. 9, make sure the hips are not twisting here. Abs are engaged. Low back is long. 5, 4, 3, 2, and 1. High clamshell. Lift the feet, flex the feet, push the heels together as you lift. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Feet down and then abduct, disconnecting the feet. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then we're going to take this leg and just get it out of the way as we straighten out the lower leg. So your leg can be in back or in front. You're going to take a nice deep breath in. As you exhale, engage your core and pelvic floor. Then lift the leg, and little pulses here for 20, 19, 18, 17, 16, 15, 14, 13, 12, 9, 8, 7, 6, 5, 4, 3, 2, 1, and circle for 10, 9, 8, 7, 6, 5, 4, 3, 2, switch directions. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Beautiful. Again, transition as best as you can with the legs together. We're going to come around onto the hands and knees now. So this wouldn't be a low back and pelvic stability class without a little bird dog, would it? This is such a well-known exercise, but what it does is it connects us to our thoracolumbar fascia, which is like an X behind the back, and it connects opposite hand to foot, opposite arm to leg. It's a really important structure to keep well conditioned. So in your quadruped position here, you're gonna pull the abs in, lengthen low back. By the way, if you have any wrist issues, you could always do fists, put your elbows on blocks. That way you're just not having to worry about discomfort in your wrists. Now from here, you wanna be very, very stable. And I'm gonna have you start with the legs. You're gonna exhale, slide the right leg back and lift it up. By the way, just this asymmetrical movement can bother a lot of people. So if you need to, just be really gentle and maybe not even lifting the leg, but sliding the leg back and keeping the foot on the ground. Okay, so modify as you need to. If you feel comfortable lifting the leg, that's totally fine. Now, some of us are really good at getting to the goal height, but we do it with a little bit of suboptimal positioning. So as you lift your leg, make sure you don't arch your back. So you're gonna lift that leg and really try to squeeze your glute. Now, if and when you're ready, you're gonna reach opposite arm forward and leg backward, and then switch sides. So I'm at the point in my pregnancy where I get very unstable, especially in the pubic symphysis. And I can feel that instability and like the threat of pain. So what I'm doing to make sure that I can still do the movement is I'm really paying attention to my breath, core and pelvic floor engagement. So I inhale to prepare, and then as I exhale, I'm thinking about the same thing we were thinking about laying on our back. Drawing the abdominals around my waistline and pulling up on the pelvic floor muscles. So it's not that you just can't do certain movements. Sometimes you can find the correct core engagement that allows you to enjoy the movement that you wanted to do without pain, but you have to be really diligent about how you stabilize. Last one here, and then lower that back down. Okay, so now I'm gonna take the block, and just for now, I'm gonna go the skinny way between the upper thighs, and I'm gonna tuck the toes. So this one, we're putting a little bit of weight on the hands. So if you have any wrist or shoulder issues, you can just squeeze the block and not lift the knees. That's totally okay. If you're able to lift the knees and put a little bit of weight on your hands, then you can do so as well. So you're gonna spread the toes wide, and you're gonna think about pressing into your pinky toes, remember, while squeezing the block. And then from here, we're gonna do a little lift, and inhale and lower. And exhale, lift. So just in case that last exercise caused any irritation, what I do as a trainer, what I do as a rehabilitative exercise instructor, is I always make sure that anything risky, we do something really stabilizing following it. So just in case, because certain movements, you know, we try, we're still learning how to do correct form and engagement and all that. And I don't want to leave you hanging just in case it did run the risk of irritating you. So we're gonna hold this next one up. And again, if you can't lift your knees, just keep the knees on the ground, but really squeeze the block. Think about the back of your pelvis widening. Hold for 5. 4, your knees are very low towards the ground, by the way. 2, and 1, and gently lower that. Nice. So that's another way of also getting your quads to lengthen, just like we were thinking about in our shoulder bridge. And now from here, I invite you to come either to your hand or your elbow, whatever's more comfortable. Again, we're gonna kind of mermaid here. And then we're gonna do a few little hip lifts into a modified side plank. So you're gonna take a nice deep breath in, and then as you exhale, lift your hips up, inhale and lower that back down. And exhale and lift. Inhale, lower. Exhale, lift. And I want you to think about really reaching up and over with your arm, because the other thing I'm trying to get you to do here is lengthen your lats. So exhale, reach up and over. Inhale, lower, getting more oblique abdominal work here, as well as some side glute, squeezing the inner thighs together as you lift. And then we'll do one more and just hold that for a moment. So exhale, hold and breathe. 5, 4, 3, 2, and 1. Inhale, lower that back down. Very nice. And then we'll switch over to the other side. Again, thinking about keeping the legs together. Take a nice deep breath in, hand or elbow, doesn't really matter. And you're gonna exhale, come on up. Inhale, lower down. Exhale up. Inhale, lower. Exhale. Inhale. 2 more. Exhale, reach up and over, stretching out through the side body. And last one. Exhale. Good. Inhale and lower that back down. Nice. And then from here, what we're gonna do is we're gonna come around onto the hands and knees again. This is a little bit of a shoulder challenge. So you probably are somewhat familiar or have heard of downward facing dog. So what I'm doing is taking the block wide between the arms. I'm gonna take a nice deep breath in, tuck the toes, and then you're gonna exhale, pull the abdominals in, shift your hips up and back. Try to keep that block. So why was I talking about your lats in that last one? Well, because that will allow your shoulders to have proper range of motion. And what the upper body does is going to affect the lower body. So if you discover that you have some tight or weak shoulders or upper back, that can definitely contribute. And just practicing like your downward facing dog like this, what I'm doing is I'm putting the block between my elbows, which will encourage me to keep my arms straighter. But also, I'm thinking about shifting my hips up and back. Now you can bend your knees, remember, as much as you want to in a downward facing dog. Your heels do not have to be on the ground. Take a deep breath here and really try to get that length in the shoulders. So notice that I'm going for a straight line from my wrist, not bending at the shoulders, straight line through the armpits, straight line through the spine. This is a very difficult position to achieve. So if you're noticing that's not happening right now, that's okay. It does get better with practice. And then you're gonna walk the feet forward. And I'm keeping my feet a little bit wider to accommodate for my belly. Slight forward fold here, take a nice deep breath. And then to come up, we're gonna exhale, engage the abdominals. We're coming all the way up to standing, and then we're gonna place that block right between the upper thighs. And what we're gonna do here are just a few Utkatasana squats. Now, if you're pregnant and you do this and you realize, oh, my belly is hitting my block, it feels a little awkward, that block has several widths. So you can go a little bit wider and still have something to squeeze. Even if you need to go the widest level, that's totally fine. Okay, so now we're gonna talk about breathing in your squat. We're gonna inhale on the way down. This is when your pelvic floor's muscles naturally lengthen, and as you exhale, they're naturally engaging and shortening. So inhale on the way down. Exhale, up. My feet are parallel, so I'm making sure they're not turned out or in or anything funky like that. Inhale. Exhale. And 2 more. Inhale. Exhale. And last one. Inhale. And exhale. Good. And release. Nicely done. So hopefully that helps you tremendously with any pelvic girdle pain that you may be experiencing at any time. Pregnancy is a primary suspect time for that, especially in those joints, pubic symphysis in the front, SI joints in the back. But no matter where you are, these are great things to do to keep your core, your pelvic floor, and that whole posterior chain of the hamstrings, the glutes, in summary or in connection also with your abs, and help to get your posture so that you have a more neutral pelvis. You're not walking around with a posture that actually irritates your low back and hips and pelvis and so on and so forth. So thank you so much for joining me, and I will see you in the next one. Bye.